So in this topic we're going to talk about med school versus the university. So this is a very common question, which is what can this medical school offer you? And they might also ask you, what can the university in general offer you? So obviously there's a key difference here. One's talking about the medical school specifically, and then the other one's talking about the university in general. So we'll start with the med school. So the main thing is, have you looked up the course? So many students, especially ones I've mentored, oftentimes they apply for a university largely because of what they've heard about the reputation, or maybe it's quite close by so they can live closer to it, but they've not actually looked into the curriculum itself, which is quite important, because if they ask you that, it's a very easy question. It just requires a bit of research, just looking into their website, seeing what they offer. So if you can't answer that question and you've applied for it just looks a bit silly. So I can start by just giving you a few examples from my own university as to what kind of things you'd be looking into. So first thing would be the curriculum. So in my university, we did the first 2 years was PBL, and then the next 3 years was clinical. So PBL I've discussed in my previous video, so if you don't know what that is, just look it up. But basically the first 2 years was lots of just reading and written exams. Next 3 years largely clinical. So clinical would be your hospital placements, learning how to actually make diagnosis. So it's a lot more practical, hands-on. So I prefer this method because it's more structured, in my opinion. I prefer to just learn everything first and all the science, get the foundations, then move on to all the more practical stuff. So some universities have overlap in between them, and personally I don't like that. I'd rather just do one thing at a time. So it's something that you should look up. Another one in terms of the curriculum is dissections. So in Manchester, they do, from day one, you basically work with cadavers. So these are people who've donated their bodies once they've died. And you actually get to make, cuts, look into the actual body itself. And one of the benefits I see to that is, for example, when you are learning how to drive, if you want to drive, you need to actually get into a car and drive. If you're just reading a book, you're never going to learn how to drive. So one of the things you can say, if that university offers dissections, you can talk about how if you want to learn how to be a surgeon, actually get hands-on experience, then dissections is a good way to get that experience. So good for surgery. And you just become more appreciative of all the organs, and it's easier to learn the anatomy because you see firsthand. You actually see the stuff as opposed to seeing it as like a cartoon or an animation, because textbooks can't show you where things are in relation to everything else, whereas a dissection will give you obviously a 3D demonstration. Then there's other things like placements. So just try to look up what hospitals you can get sent to. I'm not sure. Some universities, they will tell you which hospitals they can send you to. So Manchester, they send students for their neurology block, they send them to Salford Royal. So Salford Royal is one of the top neurology centres in the entire country. Then you've got things like the Christie. So the Christie is one of the top cancer hospitals in the entire country. So when you see that they're offering you placements in the top hospitals, obviously you're getting access to, people who are the leads in that field. So this is a bonus. Then actually look at whether they do, do they do PBL or do they do lectures. And then you can go for my previous video where I talked about PBL, and talk about pros and cons. So obviously if they do PBL, then talk highly about PBL. If they do lecture-based, then talk highly about lecture-based. And then you can talk about, which ones you prefer. And some universities, what they like to gloat about is, their accolades, their achievements. So Kiel, on their university website, they've mentioned that 80% of their research has been classified as either world leading or internationally excellent. So if you've read that, you can of course mention that. That fact is not specific to the med school, but the assumption is if 80% of their research is at that level, you'd think that some of their medical literature would also be at that level as well. Then you've got, like, say for example, my university, Manchester. So they have specialists in the specific fields that they're teaching you, actually teach you. So if that made any sense. For example, genetics, we'd have people who are lead researchers in genetics or in that subset category of genetics, or whichever category they're teaching you, specialists in that field teaching you the most up-to-date research. So that's not something that every university offers, but it's something that you could look up as to whether your university that you're applying for offers that. Then there's intercalation. So intercalation just means you take some time out in between, so some time throughout that 5 or 6 year period of your university, maybe between years 3 and 4, between years 4 and 5, where you do a separate degree. So that intercalate just means you take out another degree in between or within your medical degree. So there's many different degree options. It could be psychology, it could be public health, and this degree initially it used to count towards foundation points. So once you finish medical school, you'd then rank against every other medical student who's finished throughout the entire country, and you'd decide you'd apply for where you want to do your foundation years, and the highest ranking students got their preferred choices. And intercalation counted towards the points needed to rank higher. It doesn't count anymore, but there are some benefits. For example, if you want to apply to specialty training, if you want a job in public healthcare and you've done an integrated degree in public healthcare, that can obviously be an advantage to you. Other degrees like psychology, if you want to apply to, say, psychiatry, psychology degree can be beneficial. So it might not carry points for foundation, but it can carry points for your specialty training later on once you finish your foundation years. So they would be the main points for med school. Now let's move on to university life in general. So there's a few points that can be mentioned. First thing is, how is the university reputation as a whole? Chances are, if it's offering med school, it must be quite a top university. So you can talk about how, the fact that it's offering a med school shows that it obviously has the facilities, the resources to be able to provide that level of education. So it's obviously high standard. Second thing is, are there any other opportunities that they offer you? So this could be things like certain guilds, so football. So yeah, just different things. If you're interested in taekwondo or whatever, they see if they offer those kinds of things. So medical school really talks about maintaining a personal work life, or maintaining that work-life balance, having personal hobbies, all of these things. So if you have any hobbies, just look up, does that university offer any, do they have any of these what they call guilds or clubs or societies that offer what kind of hobbies you're interested in. Then you just look at the city in general. So is it rural? So universities like Manchester, for example, it's about 20-minute walk away from the city, about 10 minutes by bus. So it's pretty much at the heart of the Manchester Med School is pretty much at the heart of the Manchester. Universities like Aston Medical School, or that's literally within the city centre itself. And then there's universities like Keele, which is more rural. So Keele, Exeter, they have a lot of vegetation, massive fields of just grass. So depending on what you want, you might prefer the university, the city lifestyle. So it might be the nightlife, there's shopping centres, people just like that bustling nature. And then there's the rural, which is you might like, exploring nature. It's more calm and quiet, tends to be more isolated. So it just depends on what your preference is. And then does the city offer anything else? So one of the students I mentored, he likes to go fishing, and one of the things that Exeter offers is they have a massive just like lake reservoir areas, so he could do things like fishing. So that's one of the things he mentioned. And places like Manchester, obviously they have their football clubs, Manchester United, Manchester City. You might have your local band, or your band, your preferred music band, that is. They might be local there, gigs and stuff. So these are all things that you can think about.